And Seth is with us via Zoom. Seth, what's going on, man?
Morning, morning.
Adenomyosis.
All right.
Is that correct?
Yes,
Adenomyosis?
Yes. Yes, correct.
Ah, nice, man. So, what is that, Seth?
All right, so we're going on, you know, the usual. I have to share my screen here.
Mm-hmm.
Let's pull it up. All right. So, adenomyosis. Now, of course, you know, when you go into the meaning of the word, that's where you truly understand what the actual issue is. So, adeno, that in the Latin meaning means a gland. Myo means muscle. And osis means, you know, injury or disease. So it's basically a gland growing within the muscle of the walls of the endometrial tissue. So the muscles around the wound, all right, you get endometrial tissue growing within the muscle. Now the problem with that is that's not where the tissue is supposed to grow. So as you can see in this diagram here, let me get my little, I think I'll use blue. As you see in this diagram here, these are the endometrial tissue growing within the muscle.
Right.
All right. The thing is, that tissue operates the same way within the muscle as it does in the wound. So when a woman is going through her menstrual cycle, that tissue would expand, it would degrade, it would bleed, it would break down, just like the tissue within the wound, right? The only thing is that it is not in the wound. So you have a wound tissue growing within the muscle. So imagine you have this tissue growing in an area that it's not supposed to grow. It would enlarge, it would bleed, it would break down, right? Just like the tissue in the wound. Now think about what would happen when that happens. So once you have this gland forming, you're gonna get some deformities. So you're gonna get, you know, protrusion into the wound because it is swelling and expanding. So therefore you're going to get pain. Now some people may not get pain with this condition, but in most cases you would get pain, you would get heavy menstrual cycles, you'll get pelvic cramps, you would feel bloated. Right. Sometimes the uterus, when you touch it, you would get sensitivity. Also, infertility being one of the conditions suffered from with people that suffer with this condition. Now, usually, this condition affects females within the age bracket of 40s to 50s. But we are seeing today now that it's affecting younger people, right? Like many health issues, the age bracket has been reducing. So now you have even teenagers suffering with this condition. So something that was predominantly people in their 40s and 50s, now you have teenagers suffering with it. All right, so let me stop sharing this screen here as we already have an idea of what this is. Now, anytime you have issues dealing with the wound, because we're going to deal with some of these issues that affect females over the next couple of weeks,
right?
Like endometriosis and fibroids and so forth. We're going to look at those to get a better understanding of such. You have to look at hormones. Now, when it comes to causes of this particular issue, what they would say is that there is no known cause of it because it's not just one thing that causes it, it's a combination, and it can be a combination of few things. All right. And of course, I always like to tell people you want to pay attention of your entire lifestyle with emphasis on your nutrition with regards to these conditions, because a major factor involved in them with regards to the causation and even the reduction or reversal of it has to do with your hormones. Hormones are tightly regulated by things that you consume, by what you eat, which are environmental factors, and it's something we pay little attention to. I could tell you on a daily basis when I see people, and when I show people the groundbreaking evidence with regards to how much nutrition impacts their lives, the hardest thing for them to do is to make that change, because it's such a big change. I believe we are the only creatures in existence that takes nutrition for granted. we don't see the importance of it, and we don't see the relevance of nutrition with regards to our health. That is where all diseases stem from.
Yeah.
What we put into our body, right? We put in more toxins into our body from what we eat than from any other environmental factor. And we are unaware of that until I show them it. And when I show them it and I show them what changes they need to make, they think it's something that could be compromised with, right? I am not a medical association. I will not hit you a lie just to keep you as a client permanently. I would not do you that.
There have no
right?
conflict. There is no conflict of interest.
Have no conflict of interest. I will tell you the truth.
Yeah.
I do not compromise. Your body doesn't compromise. It have no compromise. All right. There are no shortcuts. There are no shortcuts. There are many people who are sick and have, they have reached to the point of surgery and death. We think in 75 years is the extent of our life. That's all that's the oldest we're supposed to reach. That's the average life expectancy in Trinidad and Tobago.
Yeah.
No, the human body is designed to live much longer, but we keep harming it, and we're looking for compromises, right? If one person, Stefan, is not frail in their 80s, it means everybody else also has the possibility and the potential to not be frail and weak.
Yeah.
And there are many people that aren't frail in their 80s. So why is it that the majority of people are so frail? Right? Because we are eating incorrectly. We don't understand nutrition. So when it comes to this condition here now, hormones play a huge part in it. Yes, cesarean section, which is something that I do hope people try to pay more attention to their health so that they would avoid doing things like C-section, because that is also a major contributor to this particular condition.
Okay.
Right? Surgeries is a major contribution to this particular condition as well, because it can cause the tissue to end up within the muscle. Yes, they would say it have to do with genetics. Keep in mind, every time I mention genetics, I must mention that is not really genetics, but it has to do with epigenetics, which comes back down to the environmental factors, mostly what you consume through your diet. All right, that plays a big role. All right, but according to mainstream science, you can't cure this condition. But here the cure: hysterectomy, remove your whole womb. To me, that is not a cure.
Yeah.
Removing your whole wound to then have to live your life on medication, or you have all sorts of other issues that going and arise from it. That is not how you deal with these conditions, right? If you want to truly deal with these conditions, I know how. I've had people with these conditions, and now they don't have them because of the simple fact that you make certain changes to your diet. I have mentioned in the past when I did with the topic of PCOS, that was either last year or year before. So, we'll have to revisit these topics sometime.
Right.
Right? That you have something called sex hormone binding globulin. All right? And that plays a major role when it comes to the binding of free estrogen. Right? And that binds the estrogen. So when people thinking that they have too much estrogen, it's not that you're producing too much estrogen. You have too much unbinded estrogen. And that has to do with the fact that the body is not producing enough sex hormone binding globulin. Now, what that also is associated with, that's associated with sugar consumption, because sugar suppresses the production of the sex hormone binding globulin, and that leaves you in a deficient state of that particular hormone that is going to bind the estrogen. All right. Then you have things like problems with progesterone. Now, keep in mind, both the estrogen and progesterone have a lot to do with the liver when it comes to hormonal production.
Right.
So then it has to do now with your diet and fat consumption. And then if you are consuming a lot of toxins, because if you're consuming a lot of toxins, your liver has to deal with that. So then the liver can take on damage and not function as it's supposed to function. So what I want to tell people is, plain and simply, if you want to understand your condition and learn on what you can do to reverse this condition, because these are very painful things. A lot of, like I'll say, having menstrual cramps, right? Excessive menstrual bleeding, all these pains associated with period, though it is common, it is very common, it is not normal, right? It is common, but it is not normal. This is why my clients who are within the range of still having, getting their period and hasn't reached menopause, all those pains and excessive bleeding and menstrual problems have gone.
Right.
have gone. They now have, when they have their period, it's like any other day. It does not slow them down or stop them from doing anything, right?
Yeah.
We have normalized ill health, and we need to change that mindset, because sometimes, because everybody having it, we believe that this is what we're supposed
That
to
is the norm,
experience.
is the norm,
No, it
yeah. We
isn't.
believe that's what's supposed to happen, yeah.
That is not normal, and we need to get that out. It may be common, but it isn't normal.
It isn't normal,
all right?
Yeah, because understand,
right?
because women have told me that, I mean, I've heard that from several women, that when it's a time of the month, they go through certain, pain, and, they say come down heavy, and, all kind of thing, what I mean? And it appears that, but I know, stress has a lot, I thought, that stress has a lot to do with that as well.
Well, and understand this, if you're nutritionally deficient, your body is stressed because you're deficient.
Yeah, but that's
exactly
point taken. So stress, it doesn't mean stress in the form of mental stress. It could be nutritional.
People associate just mental stress, but what is mental stress? Mental stress and disorders are deficiencies. Right?
Point taken. Nice, man.
So when you look at it, it still comes back to what you put into the body. Right? So if you are putting in things that are robbing the body of nutrients or blocking your body from absorbing nutrients, you're going to be stressed.
That's right. And that would lead to those type of complications. Seth, thanks a lot for the information this Tuesday. Boy, I like that. Real people calling me, Set number. So I've been putting people onto you over the last few weeks. So we'll see where it goes. I myself, I'm weaning myself into it. So we get in there.
Okay,
all right? But
good.
do enjoy your day. And people, remember, you can get Seth on 761-1952. And Seth, what's the other number?
279-3935.
Right. I will have that one.
279-3935.
Right.
Yeah.
279-3935. I'll have that on the top of my head by next week. All right. Seth, thanks a lot, Brad. So that's Seth.
All right, thanks for having me.
Yeah, but no problem.
Okay.
So